How can you disinfect your N95 mask? This is a question that so many of you have asked me. In fact, you've been asking me this question for weeks. So I'm happy to come here and talk with you a little bit about it. This is my N95 mask. And guys, I actually only have one. That's right. I'm a family physician, and because I'm not in the hospital, I'm not in the ER, etc. I only have one mask. And to be honest with you, I don't actually use it when I go out. When I'm going out to pick up a prescription or go to the grocery store, I'm following the CDC guidelines and wearing cloth coverings, just like everyone else is recommended to wear. So I don't even wear this when I go out. However, I wanted to talk a little bit about it and give you some tips on what you can do. Now, first of all, I do want to say that this session, this video rather, is intended for people who are not healthcare workers, okay? For my healthcare worker colleagues, we know that the guidelines are completely different. We're doing different stuff. And along those lines, I should also remind us that these masks are intended only for healthcare workers. Now, you might have one of these lying around for different reasons. Maybe you bought a whole bunch before things got really, really bad in the United States, or before we developed shortages, or maybe you have, maybe you work in a profession, another profession where you need these and you have them. I actually have a friend that went to his own doctor weeks and weeks ago, and the nurse gave him one of these as well. So there could be many reasons why you have these lying around at home and are using them. The question that you've asked me though is, so how do you clean them? How do you disinfect them? So let's get right to it, guys, okay? Let's talk about the benefits of this mask. Now, let's be honest, this mask does work better than a cloth face covering. Let's just be honest, right? That is the truth. These N95 masks actually filter out 95% of airborne particles, including large and small particles. A couple things need to be in place, however. This mask has to fit properly. It's got to be a nice tight seal. In fact, these have to be fit tested. Of course, they also have to be put on and taken off properly. You've got to wash your hands and all that good stuff. But there's no doubt that these masks, when worn properly, are better than face coverings. However, once again, we need these for our healthcare workers. Historically, these masks have only been intended for single use only. Yeah, this concept of reusing masks is really a newer one because we're in the middle of a pandemic. And in fact, the CDC says that N95s are not approved for routine decontamination as conventional standards of care. So we don't even decontaminate these necessarily during normal times. But they do say, the CDC, that decontamination and reuse might be needed during times of shortage to ensure continued availability. And interestingly enough, you might have heard on the news that there are some ways that we're looking into to be able to decontaminate these masks. The CDC talks about 3 methods that they think have promise. This is as of April 2020, so it's like, new and brand new. Ultraviolet germicidal irradiation, vaporous hydrogen peroxide, and moist heat, CDC says, have shown the most promise as potential methods to decontaminate N95s. Now, I know you're saying, what is that? And how do I get that? And how do I do that for my mask? Well, if that's what you're wondering, you're kind of right. Those are methods that hospitals and hospital systems are using. Those are not intended for home use. And that brings me to one of my biggest points for today, is that a lot of the methods that are suggested for decontamination of N95s, again, are meant for healthcare systems, are meant for hospitals, for healthcare workers, etc. I'm going to give you the advice that I give my own patients. First of all, decontaminating and disinfecting these at home is not so easy. First of all, using certain products on these to disinfect them can actually render them useless by damaging the material, by damaging the seal, by damaging the integrity of the mask. You've got to be careful what you put on it. Don't just assume you can spray this with anything to decontaminate it. Other methods that I've seen, I'm not sure that they're entirely safe for home use. What I'm waiting for as a physician is if there will be evidence-based guidelines for home decontamination or disinfection of these N95s. Now, until then, or until someone tells me what they are, if they already exist, my best suggestion is, for my patients and for you, and again, this session is for the general public. This is not for healthcare workers. I suggest that you use cloth masks that the CDC is recommending. Those can be washed. You can just throw those in the washing machine and you're good to go. Now, if you have an N95 and that's what you want to use, there is something that I did find on USA Today that I thought was a really great suggestion. I want to tell you about this, so this might help. It's this idea that what you do with your N95 is you take it off, you place it in a breathable paper bag, no plastic bags, but a breathable paper bag. You close the bag and you allow it to sit at room temperature for at least 7 days. And then after 7 days, you can take it out and hopefully it will be safer to use. So that's the idea of, you use it and then you put it in the bag for 7 days and wait it out, and then 7 days later. So you see how this can be a little bit tricky. Remember the things that we need to be doing in addition to wearing a mask, right? Our masks don't take away the other things we need to be doing. That's social distancing, obviously wearing the cloth face coverings, washing our hands, not touching our face, using hand sanitizer, all of that good stuff we need to keep doing. Guys, I hope this is helpful. As always, I want you to stay safe, and remember, things with coronavirus are changing literally daily. I will update you with any new information we find about this topic and others. I'm Dr. Jen Caudle, and I'll see you soon.